Now I want to introduce Victor Kogler, who is my friend and colleague and the executive director of our partner organization, the Alcohol and Drug Policy Institute, and he is going to introduce Secretary Wilkening.
Thank you, Sandra. I'm here to introduce Michael Wilkening. He has served as the Undersecretary of Program and Fiscal Affairs of the California Health and Human Services Agency since 2008. Before that time, he served in a number of leadership positions at the Department of Finance, including Program Budget Manager for the Health and Human Services Unit. Mr. Wilkening received his Bachelor of Arts and Master of Arts degree from the University of California, Davis, and I'd like to present Mr. Wilkening, our next speaker.
Thank you very much. And I'm Mike Wilkening, Undersecretary of Health and Human Services for California, and very happy to be here at the Mental Health and Substance Use Policy Forum. I'm also quite happy to see that it's been expanded to include substance use. I think that that's a good development. It's also part of where we were moving towards with the reorganizations that we've proposed in bringing mental health and substance use disorders together. In fact, one of the things also is bringing it into the health realm as well. And so that's why we'd proposed to move everything into the Department of Healthcare Services. So I think that that's a good development, and I'm quite happy to see a much expanded audience this year. I want to acknowledge the national dialogue on mental health that Senator Steinberg was talking to you about this morning. He did a good job of framing the issue. I'm not going to spend a lot of time on that. Instead, where I'm going to focus is on the governor's budget, what state initiatives we have, healthcare reform is proposed by the governor. So that's where my time will be spent, and at the end of it, I hope to have some time for questions for you, but I'll also try to get you back on schedule. So the first issue that I want to talk about is the overview of the budget. And when I spoke to groups last year, it was very different. The governor's budget proposal had just a huge number of policy issues. We were facing some pretty bad fiscal situation, and it's, as I told the groups I was talking to last year, it was the most policy I'd ever seen in a governor's budget, and I've been doing this since 1995. So, you know, with the passage of Proposition 30, with the tough actions that have been taken in the preceding years, we're back on course, and you know the budget's projected to be balanced in the foreseeable future, and the budget that's been proposed is balanced and has $1 billion reserve. Now, Senator Steinberg talked about the governor, and that the two things that he says when he walks in is hello, and then talks about restraint, and that is a common theme with the governor, is that we need to be prudent and we need to be restrained, and that we can't take actions that put us back where we were. That we've worked very hard to get out of the hole that we were in, and that we can't be moving backwards to that place. It's a place that nobody wants to be. The members who were here before and who had to deal with the reductions, I know they certainly don't want to revisit those issues. The new members definitely don't want to be put in that situation. It's uncomfortable. It's a terrible position to be in, and they're difficult choices. There are real consequences associated with the actions that are taken in these areas. And I know that the administration doesn't want to be there as well. We want to make sure that we continue to be good stewards of the public money. The Medicaid expansion. So we've framed this in terms of two parts. One's mandatory and one's optional. I'll start out by saying that the phrasing has concerned people, and saying that the second one's optional. The reason we say optional is because the U.S. Supreme Court made the expansion optional. That's not saying that the administration isn't moving forward. In fact, we have a proposal with two different paths to get to an expansion. The mandatory piece that we talk about is, regardless of what we do, there are going to be costs to the state. And those are related to, you know, the roles of Medicaid are going to increase simply from, we're going to simplify the way that people get onto the program and stay on the program. The exchange, Covered California, is going to be doing a lot of marketing to make sure that they've got as many people in their plans as they possibly can have. And so as they do that, that's going to mean that people are going to see that and say, well, you know, I'm going to apply, and some of those are going to actually be eligible for Medicaid rather than for one of the plans in Covered California. And then coupled with the coverage requirement. So we think that those three components are going to drive Medicaid expansions regardless of whatever else we do. But then we also say that we want to expand beyond that. And we have two options that we lay out in the governor's budget for doing that. The first is a state-based, and so that's building upon the current way that we do business in the state, where we have a state-administered Medicaid system on the health side. On the mental health, we obviously have a county-administered. And so it would be an expansion under a state-based approach, and then the other is a county-based option. So most of the counties right now have low-income health programs. They've opted to start expansion early under a waiver that we have from the federal government. And so the federal government's putting up 50% of the cost, and the counties are putting up the other 50. And so we've expanded the population in that manner. So the proposal in the governor's budget, one of the paths would be to continue to build upon that and to use that as a basis for the Medicaid expansion. In either of these, we need to talk about the state-county fiscal relationship and what does that mean, and who's taking on risk, and what populations are moving where, and where is that causing pressure points, and what funding sources are available. So we've started to have the discussions around all of this. There was a stakeholder meeting on February 1st. We will continue to have stakeholder meetings on this so that people can provide feedback, ask questions, comments, and so we can continue to, as our thinking evolves, tell you what's going on, or as we get more information from the federal government on various aspects of the expansion. What does that mean for California? What questions do we still have? What options do we have in front of us? And how are we going to proceed forward? Excuse me. Now, of course, all of you are well aware of realignment in 2011, and so this is kind of foundational to where we are. And as I talk about what the state-county fiscal relationship is, this is a conversation that we've already embarked upon with the realignment in 2011, and we're going to continue to have those conversations about that as we move forward. But in the 2011 public safety realignment, we realigned the funding for the Medi-Cal specialty mental health, the drug Medi-Cal, and a number of other substance use disorder programs. And we're in the process right now of figuring out what does growth funding look like. So growth funding we're expecting in September to allocate, and we're in the process of putting together a stakeholder process where we bring in county partners and stakeholders to figure out how to allocate what factors we're using to allocate the growth funds. One thing that, when I talked about the reorg earlier, that we had proposed a reorg of the Department of Alcohol and Drug Programs in the prior budget, along with the reorganization of the Department of Mental Health. The Department of Mental Health reorganization was approved, and we're moving forward with that and implementing. The ADP reorg, we had the drug Medi-Cal program had moved over to the Department of Healthcare Services, and the rest of the programs were still in the Department of Alcohol and Drug Program. those of you that administer, you know how difficult that is to have two separate entities dealing with your programs. It's borderline impossible, but it's, the departments have done an amazing job this year in trying to make sure that we're not dropping anything and that people understand where they fit and how everything fits together. We've taken in feedback on the ADP reorg. We've talked to many groups, numerous stakeholders, the counties, about what things look like. We've looked at how the counties are structured, and where the merging of the mental health and substance use disorders has been occurring. And so what we have proposed in this governor's budget is just about everything go into the Department of Healthcare Services. Those of you that heard me speak before, when we did the last proposal, one of the points that I was making is that, you know, the Department of Healthcare Services doesn't license, and that was one of the things that was of concern to us. It still remains a concern, but I do think that we can make that work, and so that's where we're proceeding with the plan this year, is to actually move everything, including the licensing functions, into the Department of Healthcare Services. We think that that's a good step, and that it aligns with where many of the vast majority of the counties are. It aligns with where the federal government's headed. We think that it makes sense from the overall perspective of bringing substance use disorder, mental health, and health into the same policy arena. And we think that overall it will help to promote the opportunities and dialogues moving forward that we need to make the entire system work. I think with that, I'm going to stop and give you guys some time for questions so that we don't run out of time here as well. So.
Use the mic. Do you have questions?
Or I'm happy to let you go to lunch too.
Do we have questions?
The other speakers wore them out.
I do have a question.
Oh,
Of course.
of course.
What kind of process are you going to use to make your decision about whether going to the state option or the county option? That seems like such a difficult question.
So that's part of the stakeholder process that we set up, where we're bringing people in so that we can hear from them about the options and what their concerns are, what they think of the various approaches. It's also going to be part of the legislative process, so the legislature is going to be very engaged in this issue. And so we're going to have hearings in the legislature that we'll talk about what those options look like and how to proceed. And ultimately, it will require a legislative action and the governor's signature of a bill.
So if there are no other questions, whoops, it looks like we have one.
So you gave them enough time.
I guess I'm the question person today. I was wondering if you represent a population that you don't feel is adequately represented in the stakeholder process for the Medi-Cal expansion.
Mm-hmm.
For example, I didn't see anybody from the autism community on the stakeholder group.
Mm-hmm.
Is there a way to request representation and participation as a stakeholder group?
Yeah, you can actually I'll give you my email address, and you can send me your contact information. It's it'll be videotaped too, so so you all will have access to it. It's MWILKENI at chhs.ca.gov. Yep. Hi, Pat.
Mike, there are lots of questions that I could ask, but in the interest of time, I won't. But one kind of overriding question that I have, and that I've heard from a lot of other people, is the Department of Healthcare Services seems to be kind of slow in hiring people for their mental health and substance use divisions,
Mm-hmm.
but particularly of interest to us is mental health. And, you know, there's a lot of stuff going on in the public policy arena related to mental health. And I mean, I'll speak for the mental health directors. We sort of feel like there are a lot of policies that are of interest both at the state level and at the federal level that aren't being addressed adequately. And as we go to Medicaid expansion, I know the dialogue so far has been mostly about what does the money look like and, you know, where are the savings going to be, but I haven't heard a lot of discussion at a higher level about the types of things that we're trying to accomplish with healthcare reform and expansion. And I just wanted to make that statement and just say, you know, we would like to be able to have more dialogue about what are the long-term goals and how do we accomplish them between the state and the county and other stakeholders.
And I know that this is a priority area for Toby, who's the Director of Healthcare Services, and also for Vanessa, who's the appointee as the Deputy Director. So, you know, but I will convey back to them the concern there, and, you know, we obviously, anytime that you have a question, we're available for it, and we're opening up the dialogues on various issues related to ACA, and so I'll make sure that that's part of the discussion.
Yeah, this is sort of under the category of better the devil you know than the one you don't know. So if you can get out your crystal ball and tell me, will the mental health specialty carve-out be preserved or not?
I'm not very good with crystal balls. I'm not sure.